Right now we have Thomas Hutchinson, and I would like to introduce him as coming from Hoag Hospital.
Oh, thank you. Is this thing working? Does that work? All right. Hello, everyone. So it's in the title, but full disclosure, I'm not a doctor. I'm not a scientist. I'm an administrator. Background operations, strategy, and finance. And so I wanted to share, thank you, Walter. I wanted to share some of the ways we're deploying virtual reality at Hoag Hospital down in Newport Beach. But first I want to tell you a little bit about Hoag. We are based out of Orange County. We are a nonprofit community hospital, but we feel we punch above our weight. We've embraced this term privatemics, where we try to bring the best part of academics with the nimbleness of a private hospital. And as such, we've climbed up the ranks in both local and national rankings. We're actually ranked number 4 in the greater LA area, in the top 10 in California, the highest ranked hospital in Orange County. We're nationally ranked in a few specialties, and we're actually in the high performing in 18 types of care, which only a dozen institutions can lay claim to that fact. And so, as I mentioned, we're in Newport Beach, California. We've expanded into Irvine, and we're currently going through a $1 billion expansion on our Irvine campus to build 2 villages, one for women's health and one for digestive and cancer. So how did we start deploying AR and VR technologies at Hoag? I want to start with a quote from a good mentor, a friend, a guiding light, Walter Greenleaf. And Walter, I cut off the flattering part of the quote to Hoag, but Walter, I've met Walter in 2020, and he's known Dr. Rob Lewis for many years before that. Walter was instrumental in guiding us in how to really deploy virtual reality, not from a clinical study standpoint, but from a deployment standpoint. And the key takeaway he really instilled in us was that there's a lot of studies out there. This technology works. All you got to do is get in the hands of the patients, and you'll see the effect of it. And so we set forth trying to do it based on Walter's guidance. So Walter, thank you. And so where this all started was Dr. Robert Lewis, our chief of neurosurgery and director of the pituitary tumor program, engaged with a company called Surgical Theater with the intent of converting DICOM CT and MRI images into 3D renderings. And the purpose of this was to practice surgery. He thought if all the best athletes can practice 10,000 hours and become the best version of themselves, why can't surgeons practice their surgery? Why can't they look at a 3D model of the brain and figure out the best approach for surgery? And so they created the Surgical Theater technology, which has then been deployed since to lung, prostate, kidney, musculoskeletal. And this did a number of things for both the physician and the patient. One, for patient education, it was significant. Once you put a patient in a VR headset and fly them through their brain, their anatomy, they start to understand exactly what their journey is going to be, and they instantly trust you. So we did a multi-site study showing patient retention. Patients who came for a consult for a cancer diagnosis, would they stay or go somewhere else for a second opinion? And prior to the VR headset, 1 out of every 3 patients would leave Hoag and go to a different healthcare system. After introducing VR, almost 100% of the patients stayed for their surgery. Now think about that from a margin perspective, from a patient experience perspective, from a physician satisfaction perspective. This was massive, and I didn't include any financials just for privacy purposes, but we saw a significant financial return in the pituitary surgery program. The flip side of this is because he was able to practice and change his approach, the quality improvement scores went up significantly as well. And so you can see, we have our literature data and then how we measured up in our Hoag pituitary after introducing this VR planning. So both from a volume, margin, quality, and experience standpoint, everything went up once we introduced virtual reality. So that got us thinking, how can you go beyond the realm of surgery? So in 2020, the year of COVID, we set forth deploying a team of 8 nurses. So we got a number of headsets, we put the nurses in a room, and we started to develop protocols on how we wanted to roll this out. And so this wonderful team of 8 nurses came up with exclusionary criteria. They went through a checklist. They created easy material for the patients to understand what the headset was going to give them. And then we created some carts for infection prevention protocols. I'll get to that in the next slide. But we split the team up to get as many headsets out as quickly as possible, because during COVID, it wasn't just treating the medical, it was treating the fear of the pandemic, the unknown, the anxiety of being alone. How can we really alleviate pain, stress, and anxiety from our patient population? And of course, you have to get through quality and infection prevention. And I know you've seen the clean box throughout the exhibit halls, but that was really a godsend for us because through many studies, it was proven that it would take all the viruses, funguses, bacterias away from the headset, and with an alcohol wipe, just to get rid of the oils from the face, it was proven that it would be a very safe cleaning system. The only thing we had to do is the headsets could not leave the room. You couldn't walk down the hallway for fear of contamination, so we MacGyvered some old EEG carts with a battery and just wheeled them room to room. And so that got us sign off from our infection prevention team. And lastly, we wanted all our nurses to know what they're giving patients. Because at first, nurses will tell you, I'm too busy, I do not have time to do this. But once they saw the content, once they experienced the distraction, they realized, oh, maybe this person won't be bugging me every 5 minutes, or maybe they will fall asleep. And so over 3 weeks, we in-serviced 90% of our nurses. We created champions on each floor, one for day shift, one for night shift, and that really helped share and promote the use of VR. So what did this result in? Well, over 3 months, we got it to 500 unique patients. Some did it multiple times. You can see the age range is pretty extensive. And we did an informal study on pain, anxiety, and stress, but you can see the reduction. I mean, we've all heard these before, 30% reduction in pain, 20% reduction in stress. These are all studies that we knew were going to happen, but these actually happened when we just deployed it. And this is across the entire spectrum of healthcare, medical, surgical, acute rehab, chemical dependency. We tried it everywhere. But what we really paid attention to is what were the patients saying. So I included some quotes on the right, but I bolded a few that really stood out to us. Help me find a safe place within myself. First time I've been able to sit up and eat since I've been here. No pain during VR, and it helped me fall asleep. Sleep, eating, relaxation, all things that promote a quicker turnaround, lowers your length of stay, better patient satisfaction, all from 20 minutes in a VR headset. So we knew this was going to be a very successful deployment. And of course, word of mouth got around, and it created some favorable press coverage. So Forbes reached out to Dr. Rob Lewis. They did an article on him. It quickly got 25,000 views. And lesson learned for me, I should have told our neurosurgery department because their phones blew up once this article came out, how do I get a headset? Also created local coverage, Orange County Register, Orange County Business Journal. So a lot of attention on Hoag being this leading institution for these advanced technologies. As Dr. Amin said, I mean, it's a VR headset. I'm not sure you'd call it advanced technology, but it was something so different that they're not used to in a healthcare environment. This also became a huge fundraising opportunity. A lot of donors perk up when they see these new technologies and how can we support it. So not only was it a benefit to patient experience, revenue, retention, but also philanthropic support went through the roof. And so because of all this is now a staple on our inpatient floors, and since we deployed in 2020, we've done thousands of deployments of virtual reality. And the last thing we wanted to do, the last pillar we need to put in place is a home. We had this decentralized platform, but we really wanted a place to call our lab, a place where we could point to and say, that's where these things are developed. So in 2021, we launched our Center for Advanced Visualization and Immersive Therapeutics. And in our 3 rooms, there's our innovation lab where industry and physicians come together. We actually developed this spine augmented reality product to put pedicle screws in with an AR headset. We have an immersive therapy room, which currently actually has the new Avara system in it, which we're working on deploying so we can have these immersive therapies. And lastly, we have a 6-seat VR theater. And this is to fly families, administrators, nurses, either through patient anatomy and education module, really designed to get as many people in as possible to experience VR because that's the best way to promote it. And so from those surgical, medical, and facility pillars, we are now expanding our reach throughout the hospital because we believe in this so much. So the first one I want to talk about is our IBD program, inflammatory bowel disease. So recently launched this year, we have a licensed care social worker that's provided complimentary as part of the program, who does very intimate sessions for people newly diagnosed or struggling with their diagnosis. And she remarked that oftentimes they leave very stressed or in a very heavy place. So we gave her a headset and she started trying on the patients. And lo and behold, after 5 minutes in the session, she noticed tears of relief or comments of gratitude. Even letters came in saying, I cannot believe the impact that VR, that breathing, that meditation session had on me after such a heavy and invasive session. And so she is fully now committed to it, and that is now part of her offering in the IBD program. She also noted that she thinks for pre and post-op patients, it would be fantastic, but we'll talk about that a little later. Next, our pelvic floor therapy department has deployed it successfully. So starting in 2024, we have 8 pelvic floor therapists who are actively deploying VR. So far, 34 have gone through it, but you can see some of the feedback. It's lowering tension throughout the body. It's actually had significant clinical improvements. So urge to urinate every 30 minutes went to 2 to 3 hours after a 20-minute VR session. Again, it wasn't a clinical session. It was just enough to lower their stress levels. And of course, they had improved tolerance to dilator usage. So all these things that are starting to expedite the healing process. Our inpatient, outpatient rehab departments actually been deploying VR for a while. When we opened our acute rehab unit, we had a smart car for people to get in and out of it, but we had nothing for upper extremity. So we deployed the Real Y series to track movements. And what we found is, although the tracking was great and the gamification of it was unique, it was actually the ability to get patients who were tired of their therapy re-engaged. And so our program director noted that there's been a number of patients where they just didn't feel like doing it today, so we tried on the headset, they got this little dopamine hit, and all of a sudden they're re-engaged in their healthcare journey. And so again, lowering the length of stay, patient experience, accelerating the healing journey. We also wanted to see how it worked on our employees. So post-COVID, we know there's the great, healthcare exodus with nurses being completely burnt out after 2 years of COVID mandates and mask wearing and hand washing. So we supplied a 4 to 6 week session, and you can see the notable improvements. 34% reduction on average in stress, 80% noticed some sort of stress reduction, and most importantly, 2 out of 3 were more encouraged to return to work than they were before the headset. This was huge for all our floors. We also wanted our community to be aware, not just through print, but through exposure to the headsets. And so we have 2 main community events each year. One is the Hogue Classic, which is a senior PGA Tour we sponsor. Has about 75,000 people, just wrapped up last weekend. And we have a number of health fairs in our cities around Orange County, where about 1,000 people attend for flu vaccines and education around colonoscopy screening, and et cetera, et cetera. This was phenomenal for people saying, what do you use it for? Just to engage and find out how we are deploying it and why it's important to come to Hogue to get access to these technologies on their healthcare journey. I'll note that handsome young lad in that blue sweater is my son, 3.5-year-old. Don't tell his mom that I did that. And we also wanted to see if anyone else was interested in what we're doing, so we held an annual symposium in 2021. And we were actually surprised at how widely it was attended. You can see the heat map down below. We had over 1,000 people tune in at some point during our day from all across the country. So people are very interested in how we can actually deploy this and what the impact is to the health ecosystem. And I saved this one for last because this is the most, I say, prominently deployed VR offering we have. So our Hogue Addiction Treatment Center, chemical dependency. So our inpatient setting, when we first did those 8 nurses rounding in 2020, reached out about 4 days later and said, we need to order 12 headsets. This impact on our population is unreal. I said, okay. So we ordered 12, and then over time, they started to really figure out how they wanted to deploy it. They created an EMR interface. They created a virtual checklist. They created an exclusionary checklist. And they also applied it to the staff because there is a lot of burnout amongst chemical dependency and addiction therapy staff. And this is all their numbers they tracked. It wasn't through something I pushed. It was just they had champions on the floor who believed in it. And so we offered it weekly to individuals over their 30-day stay, but there's moments of stress, anxiety, of the impacts of their lack of drug intake. And during those moments of, I'll call it crisis, or actually Dr. Phil O'Carroll refers to it as dis-ease, we offered a headset. And that was often enough to get them past the urge or to slow the train enough where they didn't want to leave the system or they weren't as agitated. And it reset their baseline so they could re-enter the program and continue on their journey. But you can see 149 sessions given in 2023, over 85 patients. And both the stress and pain levels reduced significantly, but we also gave them blood cuffs. And their blood pressure lowered too. So not just self-reported, but also physiology. And then we are now deploying it to our outpatient center. So similar clinical protocols, similar checklists, similar exclusionary criteria over a 6-week curriculum. We do not have the data yet, but we did order 12 blood cuffs just to make sure we can start to track it. And so in summary, since we started deploying VR in 2015 and more prominently in 2020, we've planned over 2,000 surgeries. We've given over 4,000 sessions. We've engaged with over 20 different vendors. We've provided feedback. They've given us opportunities to try products. Our patient experience scores have elevated everywhere we deployed it. Our patient retention, word of mouth referrals, and of course margin have increased everywhere we've given it. And the other thing I didn't really talk about in the presentation is as we recruit more physicians and they see our VR lab and they see our interest in these technologies, they start thinking, how can I get my program and will Hoag support me? And the answer is yes. And so that's just another consideration for them when they decide to choose Hoag is we will support this journey, we will continue to offer these technologies, and we would look to you, doctor, to tell us how to do it best. And so our hope for this year and part of next year is, as we open a new facility in Irvine, I talked about the $1 billion facility, there's some renderings of what it's gonna look like. We do have an active palliative care trial that's about to launch. We are gonna look at pre-surgical breathing and meditation. We're looking at opioid reduction in the ED. We're gonna do infusion therapy in our cancer center. Our pain management physicians, one of which was interested during his recruitment, now wants to launch it for a spine institute. Our nurses are doing their clinical ladders with VR. And lastly, I do want to do sedation for colonoscopies. So I'll probably be reaching out to you, Dr. Emmon. Thank you. That's all I got. So the question was, do patient referrals increase the margins? And the short answer is yes, because patients are choosing to come to Hoag versus a competing system in the area. And so you can track the number of patients coming from different service areas. And so we have noted that. The other thing I didn't talk about on the inpatient floors was the reduction in drug usage and length of stay, right? So if you go from an opioid to a Tylenol based on that pain reduction, that has a cost impact. And we're all contract-based. It doesn't matter if you're here for 10 days or 5 days, it's the same rate. So it's better to get them out in 5 days. And so getting them out quicker, sleeping, eating quicker has a much better profitability margin.
A very basic question for someone who's never done it. What's the very first step to find the right headset and find the right programming to get going?
Loaded question with vendors in the room. I think it depends on your program. It depends what you're looking for. If you're looking for just inpatient therapy, if you're looking for distraction therapy, chemical dependency, there's different platforms out there that serve different needs. I feel like I have a cheat. I have Walter, who I go to and I say, we're looking for this, and he says, I know these companies. I think right now, most of it, what we've used is distraction. And so I should have caveated the 3 headsets we used for all this deployment was Applied VR, Behavior, and Penumbra. All really based on the distraction therapy. Applied VR has now moved into Relief VR, as we heard. But I think those are the ones we're using for now.
So in other words, you need a liaison who understands that.
I think that helps. Hi.
Nice to meet you. One, thank you for the work that you're doing because one, I know, like you said, you're not a doctor and you're not a scientist, but the work that you've done has changed many lives. I am a sickle cell patient. Sickle cell is very painful. I was one of the speakers in the other room today, and it makes a very, very big difference. Before there was VR, there were video games.
Mm-hmm.
So my doctor had a hematology oncology over at Children's Hospital, Los Angeles. His name is Coates. I would love to introduce you guys because it's the one exact story he tells every time we have our conference, and that is that distraction. With the painful disease that we have, it is good to be distracted and to be less on medications, so we are able to explain exactly what it is that we're feeling. So I just wanted to say thank you, hopefully get your card and connect you with that, because it would be really good to start a relationship with you, because again, distraction is mainly what a lot of patients and people in the world in itself need. So thank you very much. And how do I get a headset?
Oh, fair enough. Talk to Walter about that one too.
Thank you. All right, just really quick before we adjourn here, first, thank you very much for coming to this session, and thank you to our amazing speakers. We will be having the special lunchtime symposium here in the XR Theater starting at 12:35, so please feel free to go downstairs, grab your box lunch, and come back, and we'll be starting pretty promptly at 12:35. Likewise, the deep dive panels will be happening at 1:10 after the lunchtime symposium. So those deep dive panels will be happening both here and two simultaneously occurring in the main stage as well. Thank you.